Hi everyone. I'm going to speak very loudly so that the other noise from around, all the chatting, will get drowned. But thank you for coming to this session. We are still waiting for two of our speakers. And yeah, hopefully people hearing us will come and join because it's a very different session that we have today. It's four amazing women who are going to talk about their life story. And also, we're going to talk a little bit about how this life story becomes a tool for advocacy. And, people think, oh, this is not scientific, this is not technical. But how much more scientific can we get? It's about people's lives. It's about people who've been affected by TB, people who've struggled, and people who've overcome and here with us today to share. And I think this for me is the most scientific and most technical. And this is what should be the heart of everything that we do. It's about listening to people. We use the word people-centered TB response, but with no people in the center, how can there be a TB response that is people-centered? So I hope, I've been doing this for a very long time. This is my 15th union conference. And every year, I hope that things would be different. And they do get a little different. But still, we are not there. We can do better, and we should do better. The slogan is, yes, we can end TB, but like some of the people who are affected, some of my patients ask me, yeah, you can end TB, but do you want to? I think that is something that we need to think about. We can end TB, but do we really want to? And if we really want to, then we need to hear what people who have gone through this journey are saying to us. The best of tools and regimens will only take us that far, unless and until it is a people's movement. So I'd like to invite Paran as well to come and join us here. And we will start. One more speaker, Nandita, will join us. I do have all the bios of the people, but I'm not going to use them because these are my friends. And I'm going to introduce them as my friends and fellow survivors and people who are on the journey together. So I want to introduce first Paran. Paran is from Indonesia and is a TB survivor from Indonesia. She will tell you her own story. And she has managed to use her story to inspire, to hold people accountable in her own country, in the region, and also globally. And we will hear from her a little bit about her story and how she has managed to do that. Nandita, please come and join us. Next person is, and Paran is also, I'm so sorry, I didn't introduce myself. I always forget to do that. My name is Blessy Kumar. I'm with the Global Coalition of TB Advocates that has been trying to bring people to that center. And we're a very large team of 3 people that manage the global work and the regional work, and we are based in India. We are very grateful for people 10 years ago who felt that we probably could do what we are saying we could and helped us, supported us to establish GCTA, and we have grown quite big. We have 600 members across the globe, and the only way we keep in touch is through digital media. We're all quite, we advocate together, we support one another, and we have campaigns that we all sort of sign on to. And Paran is actually one of the GCTA supporters, members, and has contributed to the work of GCTA as well. Next, I'll introduce Oksana. Oksana is another dear colleague and friend, also started off by being the first steering committee member of the Global Coalition of TB Advocates, so very much instrumental in making GCTA what it is. She also has an amazing story. We have featured Oksana in one of our books that talks about stigma and women, because 6-7 years ago, nobody believed that stigma existed in TB. So we went and talked to people, and we came out with 3 books. First with the women and stigma, and then children and stigma, and then the men said, why not the men? We also have stigma. So then we came out with a book on men and stigma. They're all available on our website. Please do have a look. And Oksana has an amazing story as well to share with us. Next is Olya. Olya is the chair of the TB People Ukraine, and another great colleague who is also a TB survivor and a great passionate advocate who brings a story to many, many high-level platforms. Then we have Nandita, who is not new. I don't know if how many of you attended the last in-person union conference. She was the speaker, the plenary speaker, and also the speaker at the UNHLM in 2018. And she challenged the leaders there, and she said, I may not be able to hear what you're saying. She will tell you why she can't do that. But she said, I hope you hear my message. And it was a very powerful advocacy tool and initiative. So we have these amazing women who will talk to us about how they've used their life story to make a difference in TB. Over to you, Nandita.
Hi, thanks a lot. Thanks a lot, Blessy, for this lovely introduction of all the 4 powerful women on the panel. So, welcome everyone here. I'm Nandita Venkateshan. I'm a 2-time TB survivor from India. And I have been working in the TB space now since I got cured and I came out of the clutches of this disease in 2016. And I had to undergo this disease twice in my life at a very young age. In the age of 17 and again in the age of 23. And I had intestinal TB, which is not a very common form of the disease, because TB is seen as something that you only contract in your lungs, but I had got it in a completely different organ altogether. And I remember that this was not something that was that many people were familiar with, and that is extrapulmonary TB. And then right after I contracted the disease, the second time at the age of 23 years old, when I had just finished my graduation studies, that is my postgraduate studies from one of the best mass communication institutes in India. And when I was kickstarting my career is when this disease resurfaced, and it sort of brought my life to a complete halt. After that, because of the kanamycin injection, I ended up losing my hearing, which is where the whole thing about I cannot hear you, but I'll make sure you hear me, that word and that sentence comes into the picture. Obviously, these kind of side effects are harmful. This is dangerous. These can be life-altering for anyone who goes through them. Not just these, TB has a range of side effects that one has to go through, even because of the medications. It could be small side effects such as nausea, vomiting. Your daily life gets paralyzed because of the disease, whether even if you get it for 6 months or even if you get it for 20 months. The fact is that when you go through the disease, your life is no longer the same for that period of time, because it's not a routine cough and cold, and and it's not something that can be dismissed. So your life gets paralyzed for those months, and that also means that if it sort of impacts your employment, it impacts your, your outlook towards your future. What is going to happen to you after the disease? What are you going to do? What are your career ambitions? What are your personal life ambitions? What is going to happen to you? That's the big question mark that every survivor sitting here on this panel, and I know some very good survivors in the audience as well who have grappled with these questions during the term that they battle this disease. And it is because of this that prodded several of us to come out and share our story and to tell people that this is a disease that just cannot be overlooked. You have to get your act together collectively at every level, and if we can do something to move the needle, then why not? And if that can be through the power of sharing our stories, through the power of sharing our stories and giving a sort of a face to the disease, then why we can do that. And we can help move at the policy table, we can help move at the advocacy table at several levels, because health at the end of the day is as much as it is about numbers, as much as it is about the statistics, which we cannot deny at all because that's the hard evidence one has. But that is also about the faces behind those numbers. It is also about real lives that have, been impacted. And that is where I think each one of us represent that. So I'll hand it over to the next speaker for.
Thank you. Okay, hi and good afternoon, everyone. My name Paran Sanita Winarni. I'm from Indonesia, and same like Nandita, I have TB for twice in 2008 with sensitivity drugs, and in 2012 with DRTB drugs. Why I become DRTB drugs? Because I have wrong treatment regimen at the private clinic at that time. So I have to get my journey for sensitivity drugs around like 2 years, and with some drugs that it is not recommended at all from the guideline in every guideline. And the doctors only check me for the X-ray without any sputum, without anything. So after 2 years, I take the medicine. The doctor once again say, yes, you cured, you can stop your medicine, so you can like be normal people again without having taken medicine every day. And maybe I back to work, maybe around like a year. I felt the same symptoms uh, in my, I mean, I felt that this is the same symptoms like I knew before. But when I go to the same doctor, the doctor said that, oh, it's fine. Nothing happened. It's almost 8 year long once again, but I don't know what is that. So the doctor double doses of my first doses, and around like maybe 2 or 3 months, I cover blood, a lot of blood, and then also from my nose also. So yeah, they refer me to the primary healthcare center, which is I knew that at the time is TB is not cost at all, because in private sector you have to pay with your own money. So in the primary healthcare center, they give me the right medicine, the right treatment, and with that I have to cost anything because it's free. So they also want me to check my sputum again, from gene expert, so to knowing is it any resistant or not. So they refer me to the referral hospital, Persahabatan. I think all of you, maybe some of you in here know. Yeah, and the result come, and I'm positive. Positive. I have to stop my previous DR TB sensitive treatment. So it continue with DR TB treatment in the hospital. So I at that time I have maybe same like you, yeah. Still with injection, and then also I have to take a pills like 15 pills every day, and yeah, it costs a lot of things. And Yeah, I mean, after all of the nightmare, in 2014 I cured, and I start to join with a patient organization in Jakarta called PETA. And yeah, my work area is in DRTB referral and then primary healthcare center to assist the treatment adherence of DRTB patient. And I move forward more for my advocacy and an activist way. So in 2019, I tried to initiate a youth movement against TB in Indonesia. It's a coalition from young people that really want to engage and really care about TB, even though they not a patient at all or ex-patient. So I also joined with several platforms like RGLC Southeast Asia, WHO, and then WHO Civil Society Task Force, which is Nandita also ever include there, and then Blazy also there. And I also joined the TB CAP, which is it's kind of like a different thing with the WHO, so because the WHO is more the guideline recommendation and other, but in TB CAP I learned about how community should know or should learn about the research itself, because nothing about us without us, even though it's research, clinical trial and everything. Because I mean the important thing, because in civil society task force, WHO include me in GDG, which is I'm one of the part that giving advice and suggestion about how the guideline it should like having the soul of the community, the soul of the people affected by TB. So I think it's kind of like complete my advocacy tools by joining TB CAP also. Yeah, I think that's my story.
Thank you, Paran. I have some slides, so I'd like to use them. I have no conflict of interest. I've been diagnosed. First of all, I would like to greet you and thank you, but you found time at the end of the day to be and to encourage our discussion. And even besides all those noise in the background, you are still with us, and we hope to have a good discussion altogether. It's very difficult for me every time to speak about my own personal experience, because from the very beginning, I always seemed in a way frustrated when I was invited to speak about the personal experience, because what I wanted to tell to people is actually why we need to listen to patients, because they bring their own perspective, and this perspective should be used to change things, not just to listen to very emotional stories and to get out of the room and forget it. No, this not should be used for that. We are opening our hearts and we are using our testimony with the impression and with a hard wish to trigger change. This is what we are doing. So I've been diagnosed with TB in 2007 with drug susceptible TB, but due to the fact that there were no available drugs for MDR TB, I was treated for the whole year using what was available at the moment in the country. After half a year, I've been added to my injectables have been added to my treatment. So after 2 months with injectables, I said now, being in a way said by the doctors that this is a huge risk, that you are saying no to the injectable because you are actually resistant to the drugs. I said no because I had terrible side effects. It was very difficult for me to focus with vision. I was losing the capacity to go steadily. I still feel this side effects when it's getting dark. So when I'm going outside, I'm going like a bit of drunk. But this is due, and this is the side effect of all those injectables. 1 year later, the second line drugs were available in the country, and so I followed the other 24 months of treatment. So, and I was just understanding how the big difference is actually between the treatment for drug-sensitive TB and treatment for multi-drug resistant TB, a very huge difference, much difficult and much toxic side effects with a longer period of recovery, which took years, again with an inception from the doctors to give me injectables, and I again said no to injectables, having this side effects and having additional treatment to manage the side effects, actually a very expensive one. I've never talked it, but it was on my own costs. I had another injections to remove the side effects and to recover and to focus my vision, to start again working steadily and being not drunk by all this treatment of TB. Happily, I'm done, and after 3 years, I've been cured. We've celebrated together with our patients. We celebrated actually the treatment with funding a TB patient organization in the country in 2010, and since then we dedicate all our work to change, and this is mainly based on building partnership. We do want to improve the treatment, the access to treatment in the country. We do consider that everything, to make a change, we need to work together. We start our advocacy in bringing different conflictual messages, and we've overcome this approach in trying to become friends with primary health care, with TB doctors, with the National TB Program, understanding that actually the conflicts will never lead to a better change, and it only will delay the access to better instruments in the country. Since 2010, we are using peer approach to link the services, and we all said it, we are linking the services, we are trying to link all the existing services and understanding that every stakeholder at the country level has his own role. And if there is a role for civil society and community to increase the access, to take every patient by hand and to show them ways, the best way to get the access, we will do it as long as it will be necessary. We provide several activities within our patient association, from service provision. We are doing active case finding, and you see some results on the PowerPoint presentation. But what we consider as our focus is actually advocacy and communication, because we want to trigger changes. We understand that there are providers which should implement services, but and if there is capacity to do so, let's do so. But if there is capacity and there is necessity to push for changes, we will mainly focus on this to trigger changes in the country. Speaking about some concrete results in the countries, there are some documents that we contributed together with our activists within the country to be changed. We are speaking about the revision on timely manner of the guidelines to access the better treatment regimens, better diagnostic tools according to the WHO recommendation. We contributed to the revision of the supportive mechanism. We are speaking about mechanism of food packages which are delivered in the country and which have been delivered only for the first for people with susceptible TB, and then we asked that it should be expanded to no matter what form of TB is people facing within the treatment. So it should be accessible to everyone. Due to another story within the community, we advocated a lot for the introduction of the new drugs. So in 2017, we had the legal framework for the introduction of bedaquiline, and since then, bedaquiline is included in the standard of care for drug-resistant TB in the country, and it is available countrywide. Recently, together with the National TB Program, we contributed and worked on the basis of a technical assistance from the WHO to develop the new TB screening guidelines at the country level, which includes different algorithms. And we, as part of national TB program are using these algorithms. We're not inviting anything. We're not working on ourselves. Everything is done all together, and we are following the same rules for civil society, for communities who are doing services, as well as for primary health care and TB doctors. As well, we are included in different technical working groups, and all our work is focused to improve the standard of care. If just to finish with some key messages, I would say that affected communities and civil society pose an unique expertise on different areas, and they are extremely valuable partners at the national level. Subnational should be taken at a common table and to be discussed together. As well, engaging communities and civil society is necessary for advocacy. I think that's the role of a civil society, to do community-led monitoring, because in this way we are contributing to improving policies and the quality of the services which are provided in the country. As well, as part of engaging in research and development in the country, as a community coordinator for STREAM Stage 2 trial and Zinix trial, we acknowledge and we try to educate community, but as well our providers, TB providers, that the study results and scientific evidence are efficient tools to advocate for implementing new technologies. And of course, engaging communities and civil society in research and participation in policy-making forums is the best way to ensure trust. This is what everything should be built within a healthy community. Partnership among stakeholders, and this will definitely support to translating the scientific evidence into concrete policies and actions and activities at national and subnational level. Thank you so much.
Thank you, Roxanne. Olia.
I haven't big presentation, but this photo is really important for me because on this photo I'm together with my daughter, and my experience in tuberculosis we had together. And my name is Ola, and I'm happy to see all of you here because it's a really bad practice year from year on a union conference when TB community and all session what we discuss stigma, discrimination, community experience. It's some places where you can work good work. It's not comfortable places, but we are all here, so it's really important for all of us and for all team what in the panel. When I got sick, I was absolutely a social active person. It was in 2015 years, and I can't answer on one question why I had experience when I faced with so much stigma and discrimination in my life, because I lost my job, I was separated with my daughter, I think I lost my face because on that period I had really strange depression, because without any support, without any help, you are alone with your fighting with tuberculosis, but you can't understand why you're alone in this way. Why your daughter must have some psychologist treatment after we had child trauma, psychologist child trauma, and our experience, one important thing in my experience, I had sensitive tuberculosis. I had sensitive tuberculosis, and my medical treatment was only 6 months. Yes, I had strong side effects. My health was destroyed, but my mental health was more biggest destroyed than my medical experience. And in a good part of my story, maybe I can say when so many people I lost people, I lost friends, I found so many people who support me. And it was really another experience in life when you can see that you are not alone, when you can return with your faith. And 2 years ago, I was pregnant and lost my baby, and must had prevention therapy. And you know, that doesn't matter. You had treatment or you have prevention therapy. It's hardly every time, because I remember when first day when I took first dose, my pills, and must take this. It's hardly every time for every people who understanding it's his reality for next 6 months, 20 months, 1 year, 2 year. After my disease, my experience, I was so angry for all world around. So I want fighting with this. And I'm being volunteer. I wrote the book about my story. I speak and open about my experience, about our Together with Daughter experience. She understand today. I think she understand what it was. But last 4 years it was really hard for us, because we find some child-centered psychologist help. I can't found, because any mental program in our world not orient for our needs. Yes, we can speaking about mental health, but people who face it with discrimination diseases, they need not enough only mental programs. They need orient for their needs support. It's really important understanding, because when we speak why people finished their treatment, why we lost our passion, because our services, it's not about people-centered care. It's about everyday must-have pills, but not about rights or people. Sometimes ago, emotion gradually subside. And it's normal process for every person who in activism, because every day if you in this area, you met so many stories where you can see how tuberculosis, HIV, or another disease, cancer, destroyed people's life. And you thinking that, oh, you need fighting, you start to understand why you're fighting. And I continue to see pain and discrimination. And I want to share some, thank you, some little story what happened with me maybe last year. I had my therapy in 2015. I had my prevention therapy in 2021. And maybe last year I need some support and help from people in our work. And for doing this, we met in her house. And in our discussion, she understanding I had tuberculosis in my life. And it was really warm dialogue. We do really great work together. But sometime after in the evening, she wrote me, sorry, can you tell me if I need some special washed places after you? At this moment, for 1 minute, I come back in 2015. But after my shock, I understand we must push it, our activities, because we need fighting with stigma and discrimination. Because every person, every people have right faced with tuberculosis. But every person, after then, when he faced with tuberculosis, he have right received human rights services. So people sent it. Sorry, thank you. It's really important, and I understand in our life, I won't be a woman who can have tuberculosis, but I won't be a woman, person who don't have tuberculosis. And it's really important why TB People Ukraine, it's a great team. More part, our team, it's people without tuberculosis, but it's people who supported our idea, who supported my idea after my volunteer experience. And we have great job with CLM, with advocacy, but we have really great part, a big part our work with fighting with stigma and discrimination, training, education, and today we try working with schools, with medical institution, with another institution where we can development program for changes, perception for civil society, because it's really important for future if we want fighting with tuberculosis. And when I started my volunteer way, I think we all have leaders or some persons who help for us, who was our motivated continue this way, continue this fighting. For me, it was Yulia Chorna. I think many people in this room know this great woman. And when I sometimes was really tired, anti-motivation, I'm crying, because I said for her, Yulia, I want push these changes now. I can't wait year, 2 year, 10 year. Advocacy is not mine part. I want change now. She told me really important things. You are a little bird and you can do only what you can do here. Please do it and do it good. And after this time, you can see how situation change around you. So in my last point, I want wish for us, please understand, it doesn't matter you big bird or you little bird, small bird. Please continue, do what you do, because only together, only continue after work we can fight in stigma and tuberculosis. Because it's not about cases, it's about Ola, Oksana, Nandita, Paran, sorry, Blessy, and so many people in this room. Thank you for your time.
Wow. Really, wow. What amazing women we have here sitting. It's not easy to come and make ourselves vulnerable, to tell our story, but they chose to do it. Whatever we do in TB, we'll never be able to make up for what they've lost. Never. But what we can do is not be quiet when things can be better, so that we don't have to listen to these stories over and over again. Stigma still kills. Stigma alienates you. Stigma makes you so much lesser than what you're meant to be. And all it takes for us to overcome that is support from another person, just like Olia shared with us. So we can be that. We may not be a great researcher. We may not be a great developer, but we can be the person who will support. Like Oksana shared, she's gone ahead and used a story to make such amazing things in her country. The association that is formed, which is now part of many researchers, bringing the voice of the people. We can do that. Like Paran has shared, she has driven herself to learn, to be on several global and regional platforms, using her experience and her story to make a difference in the lives of people. And that is very, very crucial. Nandita is now a global player. She was featured in the Times magazine as one of the top 100 most influential people. She's a journalist. I mean, it's not fun to keep talking about what I went through. I lost my hearing, but she said she chooses to do that because it'll bring a change. And if those of us who listen to these stories go away from this room, like Oksana said, and don't do anything about it, I think that'll be the biggest failure. If you can remember even a few words of these powerful women who have really battled and won, and speak on behalf of the many who are affected, let's use it in the next few days of the conference. If you're attending scientific sessions, there's time for Q&A. Raise your hand, remember one of them, and ask the question about support, about mental health, about children's health, about getting back on track, of the support that's needed. Let's ask that. Let's use these stories to do that. And before we close, I think we can take 2 questions. I don't want to use the Slido because I'm sorry the organizers did ask me to use that, but I want it to be a conversation. So please ask the question. Richa, can you pass the mic?
So first of all, amazing work, I have to say. So a little bit clap for all of the presenters. So apart from being a medical doctor, I'm also a storyteller. So just to give you background, and I'm doing my PhD on the impact of storytelling in reducing internal and external stigma, and also improving the mental well-being of people affected by leprosy. So I'm working in the field of leprosy. So my question is there something, so here what I see is amazing use of storytelling for advocacy, lobby, and mobilization of resources. Is there anything you are involved in? So I work more in the field of leprosy and entities. Is there something that is using storytelling, and there's something called participatory videos and filmmaking to reduce the stigma and also societal stigma, and to improve the mental health of people affected by TB? Because in storytelling, there's healing, by sharing your success, your pain. So that would be my question, because I haven't heard a lot about this use of storytelling for reducing stigma and improving the mental health. Thank you so much. So
No,
my
he's
question,
asking about storytelling.
so
if it
maybe
has
I can
been
just,
used.
so my question is there anything already in place, the use of, already in place, so evidence-based studies using storytelling or participatory video to improve the mental health or well-being of people affected by TB, and use of storytelling, for example, stories of people affected, and showing in the public, in society, to reduce societal stigma against TB.
Thank you. Would anyone like to answer? Otherwise, I can.
Yes, I think so, and I think that's a crucial tool in using storytelling in TB. For example, within the TB Rep project we implemented for 6 years in Moldova, we had this special activity dedicated to engaging with patients in treatment and asking their approval to do a small video spots. So we do have this kind of activity, and we play it. These video spots are placed on our page, which can be accessed. We have translation on Russian. So, and I think it really helps when you want to bring emotions to us, to something which is very technical and very scientific, bringing 2-3 minutes spot with people in treatment speaking about this brings an added value to the whole agenda of any meeting. I think that's crucial.
Yeah, thank you. I just want to also recognize VRL, who's here, who's from Stop TB Partnership. They've also done they have the Challenge Facility Grant for civil society, and many of the grants have been for projects for stigma reduction. And Stop TB also many years ago came up with a book, coffee table book, that featured many, many TB survivors and their stories in that. So I think there is some work that is happening, but we could do a lot more.
Okay, maybe I just answer your question. So in Indonesia, a youth movement against TB, we use another tools to tell the story. So maybe if all of you can see that there is just breathe, and then beside it, that is our art from the young people in Indonesia Muda untuk youth movement against TB in Indonesia. So we have another ways to tell the story to reduce the stigma and discrimination through the art. So we use one media, the same media. It's collaboration with the artist, and then also the uh, patient expression, and that is made from the X-ray. So we made it. So it's tell the story. It's tell the story from all the TB survivor, which is we collaborate with PETA and IMUT. So yeah, we do the exhibition. So NTP also sometimes do the exhibition. They're gonna invite us to introduce what is youth movement in Indonesia have done in the other ways of storytelling. I think, yeah.
Thanks, Param. So we're running out of time, so maybe we can take one more. Okay, and then we'll take the last question from.
Okay, just to add here from Union, we have this Meri TB Ki Kahani. It's a platform we are giving to normalize conversations about TB. It's a poster out there also, wherein once you log on to the site, it even directs you how you can record a very small 1-minute video. It gives you direction, and it standardizes and develops where people can, upload their video recording from their simple mobile phones.
Thank you. You wanted to ask?
Thank you so much for sharing your stories. My name is Vinita. I am a communication strategist from India. I just have one question. I mean, it's not, of course, easy to share stories, to be vulnerable, not just before an audience, but before a camera or any of that. So while there's a lot it's a technical question, while there's a lot that's going on behind creating these stories, because they're very powerful, Blessy, actually the question is to you, but if anybody can answer from their country context, what are we doing for disseminating them so that they reach the right audiences with the right power, with the right tool? Because we don't know if we're talking about video stories, in-person stories, PSAs, you said there's a book, etc. So how are we using these stories to ensure they take shape of a powerful tool and then reach the right audience? Because otherwise the full circle isn't happening, right? So just curious about that.
Yeah, great question. I'm known to be very open, and I say things without a lot of. Jeff is laughing. I don't have the knack of hiding. See, what has happened in TB now is that we go from project to project. And that kills the spirit of people. So we do things as long as there's a project, as long as there's funding. It's good to kick us off, but the passion should continue. So we've done little bits here, little bits there. Meri TB ki kahani, which means my TB story, little bit here, but as a sustained movement of people, of a people-led movement to end TB is, I think, what we all can do within whatever we are doing. If we can have that as the common thread, whether it is youth movement, whether it is writing about TB, whether it is researching on new tools, whether it is developing country-level movements, if we can have one thread that is common, about people, about the stories, and sustain that, I think that will be a great achievement. I was just sitting here and I was saying, we have Moldova, Ukraine, Indonesia, India. We're all very different people. But one thing actually brings us together is the passion for ending TB. And I would like to believe that all of us here have also the same passion, that we are all connected because we want to end TB. So I think let's keep the people in mind as we spend the next few days. Keep the stories. Remember Olia, Oksana, Paran, and Nandita, and many others who are here in this conference as we hear people. I want to give the last word to Nandita, and then we'll close.
Hi, so to answer your question, I think I'm also seeing a very interesting trend, at least in India, and that is, there's been this massive democratization of the media that has happened with the influx of YouTube that has been, and the digital media revolution that has been ongoing in India. And I see that a lot of TB survivors, away from this project to project method that has been going on, a lot of TB survivors are now taking to YouTube, for example, and are creating YouTube channels to sort of share their stories. It's free of cost. Internet is very, very cheap in India. It is one of the lowest priced in the world, actually. And I think I am sure a lot of other countries would be witnessing this as well. So I think there is a silent sort of a revolution, if I believe, that is happening, that is not really coming across maybe at these big conferences, because the people who are sitting over there are not attending the conferences. It's very difficult to get visas to countries if the conferences happen here. But if a person from, say, a remote part of India, where there is internet available today, I have seen people from the farthest, hilliest states in India having a YouTube channel and putting out their stories and saying that, okay, I had brain TB. They are speaking in their regional language. They are speaking in Hindi. They are speaking in Marathi. They are speaking in several other languages. They are saying that, okay, I had TB. Let's conduct a YouTube live now, and I'm going to tell you, and I'm going to answer queries to everyone. What is going to happen. So this is happening, actually. But it's just that possibly because conferences tend to become an echo chamber because of just the limited number of people who keep attending each and every year, that some of these stories somehow get lost. But I see this because social media, whether it is YouTube, whether it is WhatsApp, these places, these things are democratizing a lot of storytelling that is happening. So I think that a lot of people sitting here need to realize these new realities that are coming up at several places and try and discuss these even at a lot of these forums as well, and think about how we can channelize them, how we can bring them to these platforms. So I think that is one way.
Big round of applause for all of them. Remember the power of stories as you go from here. Thank you very much for joining us. All the best.